You've been coughing up a lung for days, so you go to urgent care and demand an antibiotic. The doctor gives you a Z-Pak, you take it, and you still feel like garbage a week later. Why? Because 90% of bronchitis cases are viral, and that antibiotic just destroyed your gut for no reason. This video is for educational purposes only. If you are experiencing shortness of breath, coughing up blood, have a fever over 102 degrees Fahrenheit, 38.9 degrees Celsius, or your symptoms last more than 3 weeks, go to the emergency room or see your doctor immediately. These are red flags for pneumonia, which requires urgent medical intervention. And I want to say this with empathy, not blame. If you felt miserable enough to ask for an antibiotic, that makes sense. A relentless chest cough can wreck your sleep, your energy, and your sanity. What most people are never told is that acute bronchitis is usually a self-limited inflammation of the bronchial tubes, and antibiotics do not help ordinary acute bronchitis get better. In fact, the CDC says acute bronchitis usually gets better on its own, without antibiotics, because antibiotics do not treat viruses. So what happened at urgent care? Often, the system is moving fast. People are hurting, people want relief now, and clinicians are under pressure to keep visits short and patients satisfied. That pressure can create a bad habit. Prescribe something just to close the loop, even when the science says it will not help. That is not a character flaw. It is a system flaw. The frustrating truth is that a cough from acute bronchitis can linger for weeks even when nothing dangerous is happening. The CDC notes that a chest cold usually improves without antibiotics, and other public health guidance says cough symptoms can commonly last around 3 to 4 weeks. So if you expected the Z-Pak to erase the cough overnight, the medication was never designed to do that in the first place. Here is the core difference. Viruses and bacteria are not the same thing. Antibiotics target bacteria, not viruses. A virus hijacks your own cells to make more copies of itself, so a pill that attacks bacterial structures cannot touch a viral infection. That is why taking an antibiotic for a viral chest cold is like bringing a fire extinguisher to a flood. And this is where a lot of people feel betrayed. You were hoping for relief, but instead you got side effects. The science is clear that unnecessary antibiotics can still cause harm even when they do not help the illness you actually have. That is why the right question is not, "Can I get an antibiotic?" The right question is, what kind of infection am I really dealing with? Let's slow this down and separate fear from biology. Bronchitis is inflammation of the bronchial tubes, the airways that carry air in and out of your lungs, and acute bronchitis is most often the kind that shows up after a cold or flu-like infection. In other words, the problem is real, the cough is real, and the irritation is real. But the usual cause is not something an antibiotic can fix. That is the first thing people need to understand. Viruses and bacteria are different kinds of organisms. A virus is not a little version of a bacterium. It works by invading your cells and using your own machinery to make more copies of itself. Antibiotics are designed for bacteria, so they do not treat viral bronchitis. That is why the "I need a Z-Pak" mindset is so frustrating. It feels active. It feels like treatment. But for ordinary acute bronchitis, the science says the illness usually gets better on its own, and antibiotics do not make people feel better when the cause is viral. Now, to be fair, bronchitis can sometimes be bacterial, and that is exactly why the answer is not automatic antibiotics for everyone. Good medicine is not about rewarding urgency with a prescription. Good medicine is about asking, does this person actually have signs of a bacterial infection? Or are we looking at a viral chest infection that just needs time and support? That distinction matters because the expected course matters. NICE says an acute cough is usually self-limiting and gets better within 3 to 4 weeks without antibiotics. The Cochrane Review also notes that symptoms can last longer than people expect, and that antibiotic benefits are modest at best for acute bronchitis while side effects can still happen. That is the part nobody wants to hear in the exam room. A lingering cough does not automatically mean the infection is worsening. Acute bronchitis often follows the same arc as a hard, drawn-out cold, and the cough can hang around long after the most intense part has passed. So when people expect a one-pill fix, they end up disappointed, and then they blame their body, when the real issue is that antibiotics were never the right tool. This is the urgent care secret nobody likes to say out loud. A fast prescription can create the feeling of action without actually solving the biology. The better model is simple: identify the cause, watch for red flags, and use the right support for the right illness. Viruses need time, not fake certainty. So the big takeaway is this: acute bronchitis is usually an inflammatory, often viral illness, not a bacterial emergency that automatically needs antibiotics. Once you understand that, the mystery disappears. You stop chasing the wrong treatment, and you start focusing on the real job: getting through the recovery window safely, while watching carefully for pneumonia warning signs. Now we get to the part that feels personal: the collateral damage. The gut is not just a digestion tube. It is a major immune training environment, and the microbes living there help protect us against pathogens, support immune development, and help with digestion and energy extraction. When that balance is disrupted, the whole system can feel off. That is why unnecessary antibiotics are not neutral. CDC says antibiotics can kill both the germs that cause infection and the beneficial germs that protect the body, which can leave the microbiome unbalanced. In other words, the medication may not touch the virus at all, but it can still hit the terrain your immune system depends on. And with azithromycin specifically, the digestive side effects are not imaginary. The official labeling and CDC materials list diarrhea, nausea, abdominal pain, and antibiotic-associated diarrhea as known risks. So when someone says, "I took the Z-Pak and now my stomach feels wrecked," that is not weakness. That is a known consequence of using an antibiotic your body did not need. This is where the irony gets brutal. You went in hoping to recover faster, but instead you may have added a second problem on top of the first one. CDC warns that antibiotic use can make people more susceptible to C. diff infection, and that can range from severe diarrhea to serious colon inflammation. So the same prescription that was supposed to help can sometimes create a completely new recovery burden. There is also a bigger biological cost that most people never connect to the prescription. NIDDK has reported that changes in the gut microbiome, including those caused by antibiotic use, can directly alter nutrient absorption. So now you are not only fighting a respiratory virus. You may also be absorbing food less efficiently while your gut ecosystem is trying to recover. That is why the real conversation is not, how do I hit the virus with a stronger drug? The real conversation is, how do I stop damaging the ecosystem that helps my immune system rebound? The microbiome does not need hype, it needs respect. So if you are sick after an unnecessary antibiotic, the takeaway is simple. The medicine may have been aimed at the wrong target, and your digestion is paying part of the bill. This is exactly why a recovery plan should focus on restoring balance, protecting the gut, and supporting the immune terrain instead of pretending the antibiotic was some kind of cure-all. Now let us talk about recovery, because this is where people get misled by the idea that a prescription should have fixed everything by day 3. Acute bronchitis often improves on its own, and the cough can last for weeks even after the worst part is over. That means recovery is not a straight line, and a lingering cough does not automatically mean your body is failing. The first biological move is simple. Give the virus time, and stop demanding a drug that cannot touch it. While your immune system is doing the real work, the most evidence-based support is boring but powerful: rest, fluids, humidified air, saline sprays, and soothing the cough instead of fighting reality. For many adults, the goal is not to kill the cough instantly. The goal is to make the airway less irritated while the infection clears. The NIH's NHLBI suggests at-home measures like OTC cough medicines containing dextromethorphan or guaifenesin, honey for adults and children over 1 year old, throat lozenges, and a humidifier to help ease symptoms. Now listen carefully. If your symptoms are getting worse instead of gradually improving, or if you develop shortness of breath, chest pain, coughing up blood, or a high fever, that is not the moment for self-treatment. That is the moment to get urgent medical care, because those can be warning signs of pneumonia or another serious problem. And this is where the gut and lung conversation come back together. After an unnecessary antibiotic, the recovery job is not just about the airway. It is also about the ecosystem that supports immune balance. The gut microbiome is strongly linked to immune function, and antibiotic use can disrupt it, so the body may feel more depleted than it should after a viral illness. That is why a clinician-guided microbiome repair approach can make sense as an adjunct, not a cure. NIA's NCCIH says some probiotics may help with antibiotic-associated diarrhea, but the evidence is mixed and not every product works the same way, so this is not a one-size-fits-all magic bullet. So if you want a smarter recovery blueprint, think in 2 layers. Calm the airways and rebuild the terrain. That can mean hydration, humidified air, rest, and symptom relief for the cough, while also using a carefully chosen gut support strategy, such as a symbiotic-style plan, to help restore balance after antibiotic disruption. The key word is support, not miracle. That is the whole point of the clinical microbiome repair and respiratory support conversation. Stop feeding the wrong problem, support the right systems, and let recovery happen on biology's timeline. But remember, if you have a high fever, worsening shortness of breath, chest pain, or any red flag symptoms, you need urgent medical evaluation right away. Let's bring this home. The biggest mistake people make is thinking that a lingering bronchitis cough means they were supposed to get a stronger antibiotic. But acute bronchitis usually gets better on its own. Antibiotics do not help a viral chest cold, and the cough can still linger for about 2 to 3 weeks, or even longer in some people, while the airways slowly calm down. So here is the real mindset shift. Stop treating a viral illness like it is a bacterial emergency. If it is viral, antibiotics will not make you feel better, and CDC is very clear that taking them when you do not need them can still cause harm. And that harm is not theoretical. Antibiotics can disrupt the microbiome, contribute to antibiotic-associated diarrhea, and in some cases increase the risk of more serious problems like C. diff infection. That means the medication can leave you feeling weaker, more exhausted, and more off balance at exactly the moment your body needs stability. That is why a smarter recovery plan focuses on support, not force. Rest, fluids, humidified air, and symptom relief help the airway settle. And if the gut has been knocked off balance, a clinician-guided microbiome support strategy may be reasonable as an adjunct, but not as a miracle cure. NCCIH notes that some probiotics may help with antibiotic-associated diarrhea, but the evidence is mixed and not every strain, dose, or product behaves the same way. So the right approach is thoughtful, not hype-driven. Use evidence-informed support, and do not confuse an adjunct with the actual cure for a viral bronchitis. So when you see the Clinical Microbiome Repair and Respiratory Support Blueprint, think of it as a practical framework. Calm the airways, protect the gut, and give your immune system the conditions it needs to do its job. That is a very different promise from, take this pill and everything will disappear. And before you go, hear this clearly. If you have shortness of breath, coughing up blood or bloody mucus, a high fever, chest pain, or symptoms that last more than 3 weeks, get urgent medical care. Those can be red flags for pneumonia or another serious condition, and that is not something to wait out at home. Final thought. Stop demanding antibiotics for viruses. Protect your gut, support your lungs, and let your immune system do the work it was designed to do. This video is for education only, not personal medical advice. If your breathing worsens, you cough up blood, your fever stays high, or your symptoms are not improving, see a doctor or go to the emergency room right away.